Good morning, good afternoon, and good evening, depending on your time zone. For those who don't know me, I'm Dr. Heather Stanley-Christian. I am the founder of Unity Maternal Fetal Medicine. I am taking care of patients who are pregnant and have complications in their pregnancy. And I wanted to share a story about a patient of mine. Let's call her Itch a lot. So patient IEL came into our office. She was about 30 weeks pregnant. She has had extreme discomfort, not sleeping in over a week because the palms of her hands and the soles of her feet have been extremely itchy. And it seems like it's just getting worse and migrating to other parts of her body. She's spent a lot of time in the shower just trying to seek some relief. She's tried all kinds of lotions to no avail. And she's not sure, but maybe once or twice when she was having a bowel movement, perhaps her stools were a little pale. She's not really sure about that. So on examining her, there are really no obvious rashes. However, you can see the excoriations and the scarring from her intense scratching. So what's going on with Miss IAL is that she probably has a condition called Intrahepatic Cholestasis of Pregnancy. This is where the normal flow of bile acids within the liver is actually slowed or interrupted by pregnancy hormones. It happens in 1 to 2 per 1,000 pregnancies. In certain geographic regions, it may be as high as 150 per 1,000 pregnancies. Mothers and sisters are at higher risk of developing that condition. So if you have, let's say you're pregnant and your mom, is like, yeah, it happened to me too, and your sister is planning on a pregnancy, there is an increased chance that she may have this condition or develop the condition. Why do we care about it, really? It's because there is a higher risk of stillbirth. There's a higher risk of meconium, preterm labor. We're not really sure why the stillbirth occurs. We think it's either a fetal cardiac arrhythmia or maybe vasospasm of the umbilical vessels. But we have observed it enough to know that when we have patients with these itchy conditions, we really need to check for cholestasis of pregnancy. It's diagnosed by a blood test, and the treatment goal is really twofold: to give medication to help mom with decreasing the symptoms and decreasing the bile acids. The jury's kind of out as to whether the medication actually changes outcome. And then number 2 is really the timing of delivery. So if your blood test is over 100 micromoles per liter, delivery is usually recommended at 36 weeks. If it's over 40 micromoles per liter, delivery is usually at 37 weeks. And if it's somewhere in between, delivery is variable between 37 and 39 weeks. Biophysical profile weekly is really the preferred way of testing rather than the NST, but both can be employed, one at 4 days after the other. And usually outcomes are good if we're pretty mindful with symptoms, early diagnosis, monitoring, and a plan for treatment. So that's all I have for you today. Want you to relax and breathe and keep this information for when you need it. I want to thank you for coming through and stopping by, and I want you to come find us at Unity MFM on Insta. There's a link tree there with all of our information. And I want you to walk good. Happy hump day, and I will see you next week. Okay? Thank you.